I don't think that's attractive. I don't think that's youthful.
What is the most common thing that people are not doing that they could be doing better to take care of their mouths?
Flossing. It's crucial.
Tongue scraping.
Oh, I love that. Once you see that residue, that brown stuff, trust me, you're never going to go back.
People should be doing it the first thing they wake up.
I actually recommend doing it last thing you do before you go to bed.
Oh, why do people's breath smell?
You'll be surprised how many people don't really know how to brush their teeth. Veneers should not be popping up. One of the crucial things to do when you're looking at teeth is actually you've got to look at the face. By removing the debris that collects on the in-between surfaces of the teeth, then you're just reducing the bacteria flora inside of your mouth, which can lead to the gum issues, which can lead to bad breath, which can lead to cavities.
I think it's genius. We have Dr. Sam, a facial aesthetic dentist from Beverly Hills in London, in studio today. I am so excited because you are our personal dentist too. So I feel like this episode has a lot of personality to it because we know you so well.
Maybe the best looking dentist I've ever seen, huh?
He is. Go Google him, guys. Don't get excited. He's married. Dr. Sam, welcome to the show.
Thank you so much. It's so wonderful to see you both outside of my dental chair.
Yes, our sparkly teeth.
I'm not going to lie. I do feel, listen, I love your dental chair. So I feel like I'm going to a spaceship every time I go into your office, but I do maybe I like this setting a little more.
Yeah, well, you guys are in the position of power now. Now I know what my patients feel like.
You don't have,
it's a little intimidating sitting in front of this microphone.
You don't have a pick in my mouth.
Right?
It's like one of those things that holds my mouth wide open.
I feel I wish I brought one of my syringes with me, actually, because then I feel like I have a bit more ammo right now. You guys have way too much power. I feel I feel like I'm, this is intense.
I actually found you as a dentist because I was watching Real Housewives and I saw Dorit come to your office.
Yeah.
And I was like, her teeth are so beautiful. Like, who does her teeth? Who cleans her teeth? All the things. And I sought you out. And then I made Michael. I was like, get on into the dentist.
You know, that happens a lot. We get a lot of husbands and wives. And, you know, there's always the guinea pig. So somebody will come first and they try it out, and then the other one gets, really jealous, and they're like, "Okay, when can I get in? I need to get in yesterday."
Yep.
So we do have a lot of that.
Well,
a lot of apprehension.
I think a lot of people have had traumatic experience with dentists, and a lot of people get nervous and scared. But what I found when I came into your practice was like, it's a very calm environment. Your people, the team you work with, is so great.
Thank you.
It's always so comfortable. Like every time I'm in LA now, I'm booking clean. I never did that before, It's like now I actually look forward to going and getting it clean. But it's the team you've built and the atmosphere, which was my first experience realizing that, like a dentist's office doesn't need to be like a cold, sterile environment. It could be light and bright and comfortable.
Yeah. I mean, when I first opened, like over 20 years ago, so everyone would always say like, "You're a dentist, really?" Because the stereotypical dentist is someone that you wouldn't really hang out with. Don't have that much in common with, and you are fearful of, right? So like dentistry is just like, again, like kind of like sitting in this chair right now, but but that's what it was. And I loved the art of dentistry right out of dental school. And, I definitely have a very strong creative, obviously I wear a doctor hat as well. So I understand what goes, in terms of what has to be done from a medical standpoint and from everything that I was trained for. But what they don't train you for in dental school is how to deal with that anxiety, how to come into an industry and potentially shake it up, because every dentist, would think that, okay, well, that's how my dentist was. So then I'm going to set up the office the same way. And dentists as a whole, love dentists, but as a whole are kind of like a little bit fearful of change, right? So, you have dentists who've been doing the same thing in the same way for 30 years. And, they wouldn't dream of doing it any other way because that's how they were taught in dental school. But when I started, I was like, no, this is not going to work for me because I love the job, but I don't love the setting. I don't love, everyone coming in and being like, "Oh my God, I don't want to see you," and all that kind of stuff. So that's where I started implementing those changes of, well, why does it have to feel so grim when you walk in? Why can't it have a beautiful aesthetic? Why can't you get the same feel as you do when you walk into, a Chanel store? Or, why can't you get those smells and those feelings? And why can't people be kind to you and nice to you? And, why can't somebody offer you a coffee before your appointment?
You
these
offer
are all
me sparkling water. Your team offers me sparkling water when I come in.
No,
right,
but you're
with a straw.
With the straw.
You're so right,
Yeah.
because I imagine on the other side, that's probably not a great feeling to work in a profession where people dread seeing you.
It's terrible, right? It's
Right.
all that negative energy, and they're bringing negative energy, and then we become like sponges, and then that's why you end up hating yourself and killing yourself and all the rest of it. So right off the bat, that was definitely part of my MO. That was definitely part of the agenda to change the mindset. And when you do that, it's because the thing that people don't understand is that the relationship that you have, or the sensation that you have around your mouth, is incredibly intimate, right? I've had ladies who have come to me who've literally done every procedure that there is to do in their body, in and around their face. But they say to me that, but when it comes to my teeth, I'm petrified. The thought of it sends, shivers down my spine. And so if you have somebody who's coming to you with that kind of mindset, it's really hard if you're going to be, super sterile with them. And if you're not able to break through and be the human behind the white coat and the human behind what it is that they need from a dental perspective, then, I think it's impossible to have that, the right kind of doctor-patient relationship.
One thing I appreciate about you is, and you and I feel like are very synergistic in this, is you do have an eye for aesthetics, and it shows even from your office to the way you deal with your patients. When you look at someone's teeth, what aesthetic marks are you looking for as someone who is so into aesthetics?
Well, I always take a step back. So I think one of the crucial things to do when you're looking at teeth is actually you've got to look at the face. So you can't really pull the two apart. And I think that's where a lot of errors come in with aesthetic dentistry, because you can make the most gorgeous teeth, right? Any laboratory can make you the most beautiful teeth. They can make you the most straight teeth. They can, make the color and all the rest of it. But what you have to understand is that those teeth have to go into a face, and that face is what's framing those teeth. So if you don't pay attention to where the lip line is, if you don't look at the horizontal plane of how the pupils line up, right? And if you don't work within the parameters of that person's face, those perfect teeth will only be a distraction in that face because they don't belong there. So what a lot of, I think one of the issues, and this is probably why veneers and the word veneers was kind of like a gross word. People will say, oh, why are you getting veneers? You're going to look so fake. It's because you had something that was made on a benchtop that wasn't necessarily thought out for the face that it was going into. So those are the aspects that I'm looking at. So before I look at anyone's face, before I look at anyone's teeth, I'm looking at their face. I'm looking at their skin tone. I'm looking, what are we working with here? Are we working with a younger person? Are we working with an older person? What kind of skin tone do we have? Do we have, somebody who's super vibrant, because these all play a huge role into what you have to design in order to make that beautiful smile work for that particular individual.
Makes total sense. I think it's genius. One thing that a dentist once told me, I think when I was I want to say 12, is they told me that a marker of youth is when you can see upper teeth when someone's talking. What are things that you think mark youth, beauty, and vibrance, or does it depend on what kind of face you have too?
It does. It depends. I mean, I'm definitely a big fan of the front two teeth being a bit more prominent than the teeth on the side. I think that's always instantly a more youthful look. It is obviously something that's more in tune with a woman's face than a man's face. So if you start creating that longer and then an exaggerated shorter lateral, which is the side teeth on men, that can slightly feminize the face. So you kind of, again, it's gender plays a role in it as well. And then you go into shapes. And so, an oval shape or a slightly more bell shape is more attractive, more youthful on a woman. Once the aging process affects the teeth, you can sometimes turn a bell shape turns ultimately into a bit of a rectangle, a bit of a square. And that can, again, be a bit more of an aging effect on a woman's face. But then when we're looking at shapes on men, typically, you want a little bit more of a squarer profile to the tooth. The teeth will just, in general, read a bit more masculine, a bit more attractive. So there are so many factors that go into looking to see, how you can make something more youthful. Translucency is another big factor when you're looking at the aging process and that youthful thing that we're looking at. So people, when they age, the teeth start getting a little more on the see-through side, a little bit more translucent. So the teeth start reading a bit more on the gray side. And those gray tones, if you have a bit of an older skin tone, will further age you. So, changing the translucency of your teeth, that can be another factor which adds youth to the face.
Also, this is so weird, but if someone has like gray or yellow teeth, I feel like it brings out the gray and yellows of the eye.
It can do. It can do. Yeah, it can do. And then, we are such judgmental people. We judge people, right? We see someone and you see somebody who's got yellow stained teeth and you're, in your mind, you're thinking this, they don't shower. They're probably dirty. They probably smell, right? Whereas if you see somebody who's got a clean mouth, their teeth are clean, aligned, straight, you're more likely to think that that's a clean person, a more trustworthy person. And it might not be true, right? But the fact of the matter is that's just how we read people when we see, when we meet somebody for the first time.
For general, like, tooth health, and when people come see you, what is the most common thing that people are not doing that they could be doing better to take care of their mouths?
Flossing. Nobody flosses well enough, in my opinion.
Hey, you know what? Your team taught me. I think you're gonna be impressed. I think I'm like a 9 flosser now.
But you know what's annoying, Dr. Sam, is he's leaving his fucking floss around the house.
No,
that's disgusting.
Yeah, throw it away,
that's
please.
disgusting.
Throw it away. Dr.
gotta-
Sam said that's disgusting. Don't be a 9 flosser and don't leave it around the house.
You
It's
know
like
what?
a used condom.
Well,
Please.
I will admit I have left those around at times.
Not with me.
But anyway, no. But okay, go on to flossing because
it's because
you guys taught me
flossing.
this.
Yeah, well, flossing requires quite a lot of manual dexterity, right? So a lot of people think that as long as you jam it in between the surfaces of the teeth, then you've done a good job. But that's not always enough, right? Because the tooth, a natural teeth, even veneers that are done well, there's a slight curvature to each of the teeth when they meet each other. So when you're flossing, what you need to kind of think of your flossing technique to be is imagine you're kind of doing a Swiffer of the floors, right? You don't want to just like in and out, right? You want to really clean that surface. So that's why you want to make sure that the floss is actually contacting those side surfaces of the tooth. It's not just an in and out, click, 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 in order to do it effectively.
And you like Cocoa Floss because
I love Cocoa Floss for a number of reasons. First of all, a lot of the big name brand flosses contain PFAs. So we know today that, it's a man-made product and it will never dissolve. It will never break down. So when you have, that in a product that you're using inside of your mouth every single day, that's going to be a little alarming, and you should be a bit more cautious in terms of, having any of those kind of materials because you're doing it every single day. So you're introducing a product to your mouth that's never going to break down. And that, in my opinion, is not a good idea. So with Cocoa Floss, you don't have any of the PFAs. What I also like about Cocoa Floss is that it has this slightly spongy quality. So when it comes into contact with the saliva, it's swelling slightly. So if I go back to my analogy of the Swiffer of how you want to clean those in between surfaces. So if it expands slightly, it gives you a bit more surface area to contact the tooths, and that's how you're cleaning those in between surfaces better.
Yeah, and I think like what I've learned from you guys is the importance of not only cleaning the tooth, but keeping the gum health.
Exactly. So by removing the debris that collects on the in-between surfaces of the teeth, then you're just in general reducing the bacteria flora inside of your mouth, which can lead to the gum issues, which can lead to bad breath, which can lead to cavities. So it's a very important surface within the mouth to be cautious of.
You know what I'm passionate about?
Tell me.
Tongue scraping.
Oh, I love that.
Do not have cauliflower tongue. If I went on a date, I don't care how hot you are, how big your bank account is, how big your dick is. If you have cauliflower tongue, I'm out. Like you can't. Can you talk about people should be doing it the first thing they wake up?
Well, I actually recommend doing it last thing you do before you go to bed.
Oh.
Especially if you're married or you have a partner in your bed. You want to go to bed with a clean tongue. And it's super easy.
Yeah,
and
Michael.
Super easy.
I go to bed with a clean tongue. And
it's super easy to do. Now, 2 main things that you need to think about when you're using a tongue scraper. We don't like plastic tongue scrapers. Again, plastics have products in them that you don't want to introduce to your body every single day. And think of your tongue as a super absorbent surface inside of your body, right? Think about all the drops and all the herbal remedies and all that they ask you to put on your tongue. Why do they do that? It's because the tongue absorbs into the bloodstream really quickly. So you don't want to be rubbing plastics on your tongue, once a day and, doing it several times. So stainless steel is the way to go. I prefer stainless steel over copper. I know there's a lot of copper ones out there as well, but I like stainless steel. And there's a great one that Boca makes actually with the plastic handles on either side. So it's really simple to do. You just stand in front of your mirror, you stick your tongue out, and then you place the tongue scraper as far back as you can tolerate, right? Some people have a gag reflex. And so, you tell them do tongue scraping and they're like, oh no, I have a gag reflex. Well, some of the tongue is better than none of the tongue, right? So you start as far back on the tongue as you're comfortable, and then you gently press down onto the tongue and then scrape forward. And you want to do that maybe 2 or 3 times. Once you see that residue, that brown stuff that comes onto your tongue scraper, trust me, you're never going to go back. You're never going to go back. You're going to be, and then your gag reflex will miraculously go away as well.
Yeah, don't worry, Laura's gag reflex went away a long time ago.
My gag reflex is so good. Michael's so blessed. I get that tongue scraper down my throat.
No, but you're so right. Once you start doing it and you see what comes off, you never want it there again. You want a clean tongue. Yeah,
I have a friend that I went on vacation with, and he stuck his tongue out in a photo, and my entire audience was like, ew, tell him to scrape his tongue, and like reamed him and was like, this is not Skinny Confidential behavior. They like ruined him for cauliflower tongue. He does not travel without that tongue scraper, let me tell you.
I'm glad for him.
Let's take a quick break to talk about ServPro. ServPro can make any size disaster like it never even happened. Lauren and I recently had a complete disaster at our house. For those of you that live out here in Texas or hot climates, we had our AC running and the window open. When this happens, sometimes the AC units can overrun, and we had a flood in one of our rooms. Luckily, a partner of this show is ServPro. And like I said before, ServPro can make any disaster like it never even happened. ServPro is the #1 choice in cleanup and restoration, and they can do construction too. ServPro has 50 years of experience helping people recover from disasters, and ServPro is here to help 24/7. All you have to do is call 1-800-ServPro. So when our house got flooded and we had this big disaster, we knew exactly who to call. They do so many different things, specializing in cleaning and restoration due to floods, storms, fires, mold, and more. They're faster to any size disaster with over 2,000 locations nationwide. So if you have anything going on in your house and you're looking for immediate help, ServPro is there for you. So check them out today. Visit servpro.com or call 1-800-ServPro today. Contact your local ServPro today by visiting servpro.com or call 1-800-ServPro. So check them out today. Visit servpro.com or call 1-800-ServPro today. Contact your local ServPro today by visiting servpro.com or call 1-800-ServPro.
Man, oh man, would this had come into handy when I was in college. I remember I was trying to make my apartment like the cutest ever, and it was so hard because furniture was expensive. But let me tell you about furniture rental. That's right. You can now go online and you can enjoy furniture on your own terms when and where you want. I personally think this is genius because I like to change my aesthetic frequently. I don't like to stick with something, and I like to change based on seasons. So this really lets you have the fluidity and be seamless with your furniture, which is amazing. You can be in your rent, not own era, if you will. You can step into your move when and where you want to. So the brand is called Quart. Quart makes it easy to furnish a space quickly and on your terms. You can enjoy white glove delivery. So they come, they set it up, they assemble, plus they pick it up when you're on to your next move. They also have a Quart move-in ready package, and you can receive free professional styling to ensure your home fits your needs. So not only do they have the white glove delivery service and setup included, you also get your own personal stylist if you get the move-in ready package. I think that is absolutely amazing. It kind of takes all of the pain points out of short-term living or long-distance moves or relocating. Build your own furniture rental package today at Quart.com. That's CORT.com/podcast.
Summer is here. We are hot, we are sweating, but we are not dehydrated, and that is because of our friends over at Element. Lauren and I have been avid supporters of Element products for a very long time now, which is why I'm so excited to continue talking about Element. For those of you that may be unaware, Element is an electrolyte drink mix that you just dump into your water or whatever beverage you're taking. The way that Lauren and I use it is every time we go for a workout, we dump a packet of Element into our waters and drink it throughout the workout. This is going to provide for optimal hydration throughout the entire workout. If you're somebody that gets fatigued in the middle of the day or you get headaches, it's likely not only because you're dehydrated, but likely because you do not have the proper electrolyte ratio, which Element does. The evidence suggests that we should shoot for 4,000 to 6,000 milligrams of sodium, 3,500 to 5,000 milligrams of potassium, and 400 to 600 milligrams of magnesium per day. You're also guaranteed to find an Element flavor you love. Try fan favorites like citrus salt or raspberry salt. Get spicy with mango chili, and it's so important to stay hydrated, especially now in the summer. For those of you that don't want to carry the mix, they've also introduced Element Sparkling, which is a no sugar, no caffeine, all electrolytes sparkling beverage that comes in a can. Of course, we have an offer for all of our listeners. Get your free sample pack with any drink mix purchase at drinkelement.com/skinny. And if you're an Element insider, you have first access to Element Sparkling, a bold 16-ounce can of sparkling electrolyte water. Again, that's drinkelement.com/skinny. Those things, like we're kind of going down a wellness path here with the floss and the scraping. Like, what are some of the long-term effects you see of people not doing that you have to go in later and correct?
Yeah, it's well, your mouth is such an important part in your body, right? That's how you eat, right? You breathe through your mouth. So it's such an important portal. So keeping your mouth healthy is not just health of, it's not just oral health care that we're talking about here. It's general well-being. Reducing bacteria levels. There are stress hormones that can come into your mouth, and reducing those stress hormones by having very good oral hygiene can actually help you with sleep. So it has a lot of systemic effects. There are conditions of the heart that can be affected by having high levels of bacteria in your blood levels. Right. So you've really, you've kind of got to look at the mouth as a very important place from where your general health starts. And I feel that people who do have good oral hygiene and look after their mouths, it's kind of a precedent of how they're living their lives and how they're treating other parts of their body. So it's a great start, and it's crucial.
Yeah, I don't think. I mean, people are starting to talk about it more, and obviously you're on the podcast, but I don't think people realize. I mean, they do. They got to know inherently how important this vessel is for us. I mean, I've been thinking about blood pressure.
Yeah. Yeah, there's nitrates that, if you, for example, there are some mouthwashes, again, this is going to bring me on to my next thing, but that will affect if they're killing too many of the bacteria, because there are some bacteria in your mouth that you actually need, and it can change the flora. So flora is basically the amount of good and bad bacteria that you have inside of your mouth. So if you disrupt that, then you can actually, there's studies that have been shown that it can affect your blood pressure, and it can have cardiovascular effects, negative cardiovascular effects. So it's definitely something that you're right. It has been undermined. People have kind of put it to the back burner, but they're like, oh my God, it's just my teeth. Or, I have patients even until now that say that, they only brush once a day. So oral hygiene, I think, is absolutely crucial in today's mindset where we're so concerned about wellness. You cannot have a conversation about wellness and not include oral hygiene.
I think that a lot of people who are listening probably use that nostalgic mouthwash because they're addicted to the nostalgia.
Want the burn, right? They think the more it
my dad used to use brown Listerine, and I associate that smell with my childhood. But people don't understand what you're saying about the flora and the mouth. And you're a fan, I know, of organic oil pulling. You actually have your own rinse. I use the cinnamon. It's so good. Michael likes the peppermint. What are the benefits of oil pulling?
Well, oil pulling's been around for thousands of years. So, some people think that, oh, it's a fad, oh, I've heard about it or whatever, but it's actually been around for a very, very long time. And in my book, if something's been around for a very long time, there's got to be truth to it, right? Because things that are a fad or things that don't work, they're not a fad anymore. And then, 100 years later, nobody's doing it, but people are still doing oil pulling. And the basic chemistry behind it is that you have molecules in the oil that will physically bind to those bad bacteria and viruses that you can contain within your mouth. So they actually bind to them, okay? And that's why oil pulling has to be done over a period of time. So as you guys already know, I've told you this 1,000 times, doing it in the shower is the best place to do it, 5 to 10 minute swish. So you've got the oil all engaging into these, things that you don't want inside of your mouth. And then you spit it out. So it draws it out of your mouth. Whereas that mouthwash that burns, or that mouthwash that, you swish around, there are plenty of bacteria that you have. And what we call them is they're hydrophobic, right? So they don't like water. So they go under the gum line. So they're not necessarily in a place where that mouthwash will attract them. So yes, that mouthwash, after you've rinsed out, you may feel like you have a bit better breath. That sting that you get, psychologically tells you, oh, now I have a clean mouth. But you'll be surprised how much of the bacteria that you don't want inside of your mouth is still in your mouth following using those mouthwashes. So that's where I see, the big difference.
And aren't they finding that some of these mouthwashes actually have some ingredients that are not so great for us? Is that?
Yes. So obviously a lot of them have preservatives in them and all kinds of different artificial things. And those burns are caused by chemicals that are not always good for us. Again, it's running more of a psychosomatic of that feeling that, oh, it's burning. So it must be doing a good job inside of my mouth.
And does the oil pulling with the coconut oil, is that good for the good and bad bacteria?
Yes. So It maintains the flora. So it's removing what we don't want inside of the mouth, but it's not taking away the bacteria and the organisms that we actually need inside of our mouth for digestion purposes, and just keeping up that flora to be in a healthy state.
Why do people's breath smell? What does that come from, and how can they fix it?
Okay, so halitosis is the polite way of saying you have bad breath, right?
Oof, that's
I would rather you say I have bad breath than I have halitosis. For some reason, that sounds worse.
Oh, really? Fair enough. Yeah. Well, this probably sounds like more like a disease, right?
Yeah.
So a number of reasons. Within the mouth, obviously, oral hygiene does play a huge role. And that's why I said tongue scraping before you go to bed at night is such a good idea, because part of halitosis can be from food that's basically left on the tongue. And if you put your food in the rubbish, right, and you come back and you smell the rubbish, it smells, right? Oh. So it's kind of a similar process. So by removing the debris that's sitting on your tongue, you are reducing the number of those bacteria and that food debris that essentially could rot inside of your mouth and create that bad smell. So tongue scraping, flossing is a huge part that could lead to halitosis. Again, if you have spaces or if you have pockets within your teeth which could collect food, which the food again goes down its degradation process, which can create those bad smells. That's another factor that you have to take into consideration. Brushing your teeth, obviously, that's huge, and it's important to remove any debris that you have on any three of the surfaces. You'll be surprised how many people don't really know how to brush their teeth. So, anyone who comes and has consult for veneers with me, I literally have to sit down and go through all these steps and all these protocols, because your tooth has three surfaces. You're not just brushing the teeth that you can see in the mirror. You've got to brush the surface that you're chewing on. There's the top surfaces, and there's also the whole inside surface of every tooth as well. So all three surfaces have to be cleaned well. Dehydration plays a huge role in halitosis. So, if you're not drinking enough water, that's a huge factor.
Taylor, you drinking water back here? This guy back here has never met a glass of water he likes.
And then, of course, the kind of foods that you eat. You got to be careful with the type of foods that you eat.
He eats Panda Express orange chicken every day for lunch.
Well, I'm sure he flosses and brushes afterwards.
I'm sure he doesn't.
He doesn't have halitosis.
You need to give him that oil pulling.
Well, I don't.
No, Michael is a psycho.
Oh, no, do you know why? Because Dr. Sam taught me about the three surfaces and the flossing.
Yeah, you taught us how to brush our teeth. And
it sounds strange.
That sounds strange.
Yeah, I know. And, for a long, when I first started, I just thought, well, everyone knows how to do that.
No, they don't teach you.
I don't need to teach them that. And then we would do veneers, and then they would come back and things were just not where I wanted them to be. So I was like, fuck it. I'm just going to teach people how to brush their teeth right when they sit in my chair. I don't care if they're older than me. I don't care if they're going to get, if I'm being rude or if I'm being patronizing, but I'm going to do it, because if you don't tell someone, then, you can't assume.
The best tip, I think it was you or Dr. Lee in your office gave me, was you can't be brushing your teeth and doing something else.
No.
So I will be brushing my teeth and cleaning up the bathroom. Michael's floss is everywhere. I'm cleaning up that. That takes a long time. But I mean, I'm just doing other things. And I think when you told me that, I stopped habit stacking brushing my teeth.
No, but there's the toothbrush that you gave us, and I use it now as like a little bit of form of meditation because it's a 2-minute brush.
Yeah.
And you get the green, what's a brush we use? It's like an oral.
It's the Oral BIO.
Okay,
Yeah, I
Oral
love
BIO.
that. I love that toothbrush. And the two main reasons that I love that toothbrush is small round head, right? Small circular head. Your teeth are small and circular, right? When you think about it. So you get much better engagement of the brush to the tooth surface. Some of the other, big brands, I'm not sure whether I should be speaking for you. Okay, fair enough. But, we used to be a big fan of the Philips Sonicare. Love Philips Sonicare. It's a great company. But I don't like the size of the head because it's really hard to get to the back surfaces of the teeth. You end up having to like come over and back and then position in, and people have a hard time doing that. But when you have a small circular head, it's very easy to pivot and get those back surfaces. And the other thing that I love about this toothbrush is that it has that pressure indicating light on it.
It's the best.
So the big problem that we have with patients is they either brush too hard, and it's usually the guys who do that. So they're brushing aggressively. They're like, okay, let me get these stains out and just go full force. And when you do that, you cause gum recession. So gum recession is not good. It causes sensitivity. And when we're talking about the aesthetics, the youthfulness, recession makes you look older because now, have you heard that, English people say it a lot, long in the tooth?
Right? I say long in the tooth every second, but I mean like long in the tooth, like they talk too much.
Oh, really?
Yeah, but
you use it the wrong way.
It means old.
Fair enough. Okay.
No, it's not. It's funny when there's
Yeah,
we've had a debate on this show.
Long in the tooth. I'm in a trademark. Go ahead.
But doesn't long in the tooth mean that it's because a horse is aging? Is that what it is? And then they think.
Well, no, because as you age, the gums, and if you're not good with your brushing, you get the recession, right? So now you've got the tooth is,
Watch, Taylor,
it's
I
longer.
swear that this term comes from horses aging.
I rebranded it to be like that person is long.
We can come
but
up with our own.
you're using it the right way. She uses it as people talk too much.
I think
fair
when
enough.
people talk too much, I say, woo, they're long in the tooth.
But you're saying it indicates age, which is the correct way.
It does.
It's not talking.
I don't think it's talking.
Thank God we settled that. It's been 2 years of settling that debate.
Go ahead. So the gum
So
makes
recession,
you look older.
so that's why I like this toothbrush because it has the pressure indicating light on it. So what I was coming back to is that we get a lot of patients that either brush too hard or in some areas they're not brushing hard enough, so they're getting the accumulation. So this toothbrush has this light on it on the neck of the tooth. When you're brushing at the right pressure, the light will go green. When you're brushing too aggressively, so when you're being too hard, it's going to go red. So the red is an alert. Hey, relax, right? Don't press too hard. And then there's another light is when you're being too gentle. So that really enables people who use this toothbrush to regulate the pressure that they're applying to the three surfaces of the teeth. So it's literally foolproof. And that's what I love about it.
And then it gives you a smiley face with stars if you did it right.
I have a white one and a black one that I got from you guys. And I use my white one in the morning and the black one at night because I don't want the same bacteria. This is my theory.
Well, it's going in the same mouth if you think about it. Yeah.
It's my theory.
But I think, that's great. I'm sure that's a nice aesthetic on your bathroom, but it's not necessary.
Okay.
It's not necessary. And again, you definitely want to put the cap over the top because there have been studies that show that, when you flush the toilet, there can be things that can get onto your toothbrush.
I've learned to shut the lid.
So yeah.
Do not go to the bathroom in my bathroom. That bathroom is not for you to use. Go use your bathroom in your man cave.
Let's talk.
I don't need you.
Let's talk about
the
aesthetics
floss
here
is enough.
and veneers for a second. When you see, you helped me with my front teeth because I knocked my teeth out when I was 7, and so and then I got a job and it was a mess, and you completely fixed it, and now I'm like smiling like a king over here. But
Johnny Bravo.
When you see patients come that are either you're correcting or want veneers, what do you see patients either asking other dentists maybe the wrong things or doing the wrong things? What are you correcting? What are you hoping to see, not see? Like, let's talk about veneers for a little bit because we see a lot of obvious ones that are maybe not so great. And then we see like mine, I think like the front, you could barely even tell, which is your work. But what are patients doing wrong maybe when it comes to speaking to their dentist about veneers? Right.
So there's two issues that we typically get to coming to the office. One is functionality. And the lady that we just saw earlier, she mentioned that to you, right?
Yep.
Didn't she say, she was like, oh my God, I need to come and see you because my veneers keep falling off, right? Veneers should not be popping off. So a veneer that pops off, regularly, just during normal functioning, that's an issue. So you shouldn't be living with your veneers popping off from time to time. Now, I don't want to set false expectations. If you get punched in the face, if you go skiing and you fall, if if you have trauma, the veneer can break, your tooth can break, you can have fractures. But the fact that they fall off, that's a functional issue, which leads back to how are they designed? So the preparation of the natural tooth structure is a crucial part of it. Sometimes, you may have some dentists that reduce too much natural tooth structure, so now you don't have enough actual tooth to hold on to. And if that's the case, again, the remedy has to be sorted out before you put your new veneer over the top. Then the actual placement of the veneer. Placement of veneers is something that's incredibly technique sensitive. So you have to have an area which is completely dry. You have to have your systems down in terms of the products that you're using and how you're applying the product to the natural tooth structure and following all the protocols really rigorously. Because if you don't do that, again, you can have these things fail. So it is a failure of the restoration. So we have functionality. Functionality can be them falling off. Another functionality issue can be bite, right? So our teeth, a lot of times I have to remind patients when they come and see me, just because they want to prettify their teeth, is your teeth are not just for looking at. You use your teeth. You have to chew with them. You have to eat with them. You have to speak with them. The teeth play a huge role in enunciation, specifically of words like S and 66. If you make something a little bit too thick on the inside, you're going to have a hard time enunciating your S's. So the teeth have to be functional. So those are the parameters that we get people coming to see us in terms of revision work. And then, of course, aesthetics. So aesthetics, there is, I would say, a global trend for a little bit more of a natural aesthetic. When I started doing veneers, over 20 years ago, specifically my US patients, the demand was, I want them all to look, they should all be on the same plane. So they like teeth which were all level. They didn't like teeth that were up and down. They didn't like anatomy. So they didn't want to see much anatomy in the tooth structure. And then they wanted them, toilet bowl white. So that was, not that I gave them this, but I'm just telling you that's basically.
I know you want this, but I'm not going to
let you have it. But that was kind of, I would say, what was typically requested. But today I feel that there is a change and people are seeing the beauty behind a natural aesthetic. They understand how natural can actually look more attractive and natural can actually enhance the face as opposed to potentially creating a distraction within the face.
Yeah, you don't want someone to just be staring at your teeth when they're talking.
No, but when
or the teeth to speak before you do.
Yes.
Right? Because sometimes you'll see someone. No, it's not long in the tooth.
She's not gonna let it go.
That's obnoxious teeth.
No, so when I was 7, I wish I had a cooler story, but I fell off a ramp rollerblading of all things. I just really wish it was much cooler. And for years I did, what is it called? Bonding?
Yeah.
Or cap things. And I finally just got so fed up with it because they kept coming off or popping off.
They would fall off, I remember.
Yeah, when we were kids. And so but when I came to you, I was like, I don't need giant chiclets announcing, I don't need my teeth to walk into the room before me. You know what I mean?
Which celebrity are people bringing to you all the time?
We talk a lot about Margot Robbie's smile.
Yeah.
I think she has a really gorgeous smile.
She does.
And so, I've broken this down on my social media a few times. What makes her smile attractive? Because it is a natural smile and she's naturally beautiful, right? So she's got a very, very attractive face and those teeth belong in her mouth really well. So she has that classic lineup of teeth, which I admire in a woman, where the front 2 teeth are more dominant. And when you look at where the front 2 teeth line up, so the wall of the front 2 teeth where they meet each other, that's what we call the midline, right? So that line, that vertical line, how your front 2 teeth meet up, they are very well centered within her face. So that sets you up for symmetry. So if you put an imaginary line at the cross point of where the pupils are in her face and draw a line down the center of her face, then her front 2 teeth will literally be sitting on that line, which gives you a really nice symmetrical outcome. So the symmetry there is beautiful. And then when you go to the teeth on the side, they are slightly shorter, right? So those are the laterals. And that gives that kind of bunny smile, that sexy, that youthful, attractive smile. And then when you go to her canines, they have a bit of a point to them. So again, the trend back in the day was, I don't want canines. I want them to be flat. I want everything to be on the same line. But again, I don't think that's attractive. I don't think that's youthful. So she has a bit of a point to her canine, which is sexy. And then after there, the premolars, which are the teeth after the canines, which were not done, by the way. Back in the day, veneers where you get 6. That was the typical number of veneers that you would do. And that leads to the horsey smile, if you want to know. Yeah, that's
6,
where
like
when you could use the front 6. Yeah. So, I mean, sometimes we do 6 until now if you've got great architecture in the backs, but it can also be a huge giveaway when you do 6 and then you don't do the 2 premolars on either side. Because as soon as you turn your head, or if you do your big cheesy grin or a really big smile, you can see where the veneers finish and the natural tooth structure starts. And then it's a giveaway. It's like, oh yeah, you've got veneers.
One thing that has helped me so much with losing 60 pounds, you guys know this if you follow me on Instagram, I just put up an Instagram post of the journey that I have been on for the last 2 years, is really loading up on protein. And there is a grass-fed beef protein powder that Michael introduced me to. It's called Equipped Foods Prime Protein. And Prime Protein is made with grass-fed beef, which is really important to me. I always try to check for grass-fed beef, and I love that this protein powder has it in it. So how I like to consume protein powder is I'll do 1 scoop. This one has 20 plus grams of protein, which is equivalent to 4 ounces of beef. And then I'll add maybe some fiber powder with it. And sometimes I'll add like a little bit of like chocolate sauce or cacao, and I'll mix it up with a frother. I'll add ice and I'll drink it down. And sometimes I'll do 2 scoops. This one's a really good protein powder because they third-party test for heavy metals and pesticides. It's also really carefully sourced with real food ingredients. I always try to look for real food ingredients when I'm sourcing protein powder. It also has naturally occurring collagen, which is so good for your hair and your skin and your nails. Go to equippedfoods.com/skinny to get 20% off or use code skinny at checkout. That's EQUIPFOODS.com/skinny. As you know, I have been on a journey to making my home in Texas non-toxic. I'm really trying, guys. I'm doing everything I possibly can to really just be thoughtful about my home. I started on this whole endeavor probably, 3 years ago when I moved to Austin. I just wanted to transform our entire lives. And I feel like when I'm home now, my nervous system gets reset because we have been so purposeful with what we bring in our home. And one thing I learned recently was that there is a lot of toxins in the garden and in the yard. The American yard has some of the highest concentrates of pesticides. There are 5 times more pesticides used per acre on lawns compared to industrial farms, which is wild. So enter Sunday. I found this brand online. I did a deep dive and I basically switched all my lawn products to Sunday. So Sunday's amazing because there's no toxic pesticides or harsh chemicals. My kids' feet are in the grass. My dogs are in the grass. My dogs are eating out of the grass. So I really just wanted to know what was in the yard. Sunday also has really nutrient-dense, simple ingredients. They have seaweed and molasses and iron, and they work with nature to help you grow a beautiful lawn the easy way. So better for you lawns, plants, and veggies. Sunday is available at Target, Walmart, and Lowe's stores nationwide. Use code SKINNY20 for 20% off your custom lawn plan on GetSunday.com. That's GetSunday.com.
Quick break to talk about taking care of someone other than yourself. And that is the pet that loves you the most, your dogs, the ones that love you unconditionally. And that's why I'm so excited to talk to you today about the Farmer's Dog. The Farmer's Dog makes real fresh dog food and delivers it right to your door. Recipes are developed by vet nutritionists made from real meat and veggies and portioned just for your dog, making it easy to say goodbye to burnt brown balls and feed your dog with real food with real benefits. We spend so much time thinking about what we're going to feed ourselves, what we're going to supplement with, and not nearly enough time thinking about what we feed our pets. Many may not be aware that traditional dry and wet dog food options are highly processed, can use much lower quality ingredients than they claim to, and are extremely difficult to portion accurately. The Farmer's Dog isn't just healthy, fresh, high quality food. They also send the food pre-portioned specifically for your dog based on their unique needs. This makes it easy to help your dog maintain their ideal weight, which is one of the biggest predictors of a full, healthy life. Dogs at a healthy weight can live up to 2.5 years longer than dogs at an unhealthy weight. And what's also great is it doesn't matter if your dog is young or old, it's always the right time to begin investing in their health. That means more happy, healthy, and full years together. Of course, we have an offer, and it's a great offer just for our listeners. Get 50% off your first box of fresh, healthy food at thefarmersdog.com/skinny. Plus, you get free shipping. Just go to thefarmersdog.com/skinny to get 50% off. That's thefarmersdog.com/skinny.
She does have a beautiful smile, and that line makes total sense.
Yeah.
I would love to talk about children and their palate. I am noticing, you're the perfect person to ask because you're aesthetics. I'm noticing that, call me crazy, the lack of us chewing hard foods as kids is leading to underdeveloped jaws and mouths. Have you found that? And how can we combat that in our children?
That's an interesting question. I mean, I want to preface that I'm not a pediatrician. I don't do pediatrics.
Yeah.
So it's definitely not an area of expertise for me. I would say that could certainly play a role in it. I think a bigger adjunct to that developmental issue is mouth breathing. And the reason I say that is that some of my kids, I've noticed that they started mouth breathing, and I'm seeing changes in development in terms of how the lower third of the face can form as a result of that. So I think that's a crucial part, within the development of the palate, because that's an area that needs to develop over in that period of time. With respect to the experience that I've had with children, one of the things that happens a lot as part of orthodontic treatment is extraction of premolars. So especially when I was a child. So that was the routine thing to do. Parents would bring their children's teeth were crooked, right? So what crooked teeth means is that there's just not enough room. So they need more room in order to straighten these teeth out. So then they would routinely extract the premolars, right? So four premolars typically are extracted. And then now when I see those children as adults, they have the narrow smile because they have one less tooth in the arch form. So
is that your wisdom teeth?
No.
Okay.
No. This is before the molars.
So you don't want to get those distracted.
I do not like the practice of extracting premolars. I would tell parents who listen to this podcast to be cautious when you do that, because yes, it'll give you the space with which you can straighten the teeth out. But then as an adult, we present with different aesthetic problems, which is typically that narrower smile.
I'm reading this book called Beauty is in the Bones. And in this book, the woman recommends widening the palate as a child so the child can breathe better through their nose. Have you heard of this?
I've heard of things that circulate around there. Again, I want to preface that it's definitely not my area of expertise, and I wouldn't want to pass judgment on something like that because I don't have the education that would be able to give me that viewpoint. But I'm sure these things are all heavily related to one another. And
are you a fan of mouth taping?
I am a big fan of mouth taping.
You are?
Yes.
So you're even as an adult?
For many reasons, actually, even outside of the development of the palate, because when you are breathing through the mouth, you're also, again, it's the bacteria's inside of your mouth. You're changing the bacteria flora slightly because you're introducing a lot more air and oxygen into the mouth than you would if your mouth was closed. So yes, I think if you're a mouth breather, it is a good idea to use mouth tape.
I got you some Skinny Confidential mouth tape. And Monica, we need to get Skinny Confidential mouth tape in your office because it's aesthetically pleasing.
It is aesthetically pleasing.
It's beautiful.
But Michael, do you wear one?
I think that I do wear them at times, but I also think I'm a nose breather.
Okay, that's good. Because I was going to say, what happens when you have a beard or when you have facial hair?
It does. My mouth tape is very strong. Very strong. I designed it to be the strongest, but it is, I think, more for women.
Okay.
I have noticed, and this call me crazy, since I started mouth taping, that the muscle in my jaw has become stronger, which has given me, I don't know if I'm just such an aesthetic person. It's given me more strength in my jaw, and my tongue posture has changed, which has kind of changed my face.
Oh, it's huge. Like those things make a huge difference.
I never thought about it until I got older and when we started talking about it a lot more with people. But now that I've seen it, now I can't unsee it. You know,
Yeah,
when I see people.
no, it's huge. I mean, one of the things you were talking about, anti-aging and how teeth can play a role in that. When we age, one of the things that happens is our back molar teeth get shorter, right? Because we're grinding our teeth, we're stressed, and the whole aging process makes this back supporting area shorter. When this gets shorter, the lower third of the face becomes collapsed because this is what's holding your jaw from closing all the way down. So if you've ever seen somebody who has dentures, right? When they take their dentures out, the whole face like kind of disintegrates. So now you know the value of your teeth because it's the teeth which is supporting the lips and it's also holding the jaw in the position that it is. So one of the things that we do often on cases where we're doing anti-aging dentistry is we increase that vertical dimension. So by making your molar teeth slightly taller, right? Now you're not able to shut down quite so hard. And if you have a collapsed lower third of your face, that actually makes the angle of the jaw stronger because now your chin is not so far forward. It's a little bit further back because you can't shut down so much.
If you guys are listening to this, you can tell that there is so much detail that goes into making a smile youthful. It's not just putting veneers in there.
Oh, no.
If someone is listening from a different country, a different state, maybe they don't have the funds to come to you. You're the best of the best. What would you tell them to look for in a dentist who's performing veneers?
Well, I would tell you this. First of all, I'm a big fan of prevention, right? So a lot of what I'm telling you can actually be prevented. So the collapse of the vertical lower third of the face, if you commit to wearing a night guard in your 20s, and that's a big ask because when we're 20, we're reckless, right? We don't care about those kind of things. We're just too busy trying to shag.
If you tell them their teeth,
well, wonderful.
If you tell them their teeth are going to collapse, their face is going to fall.
But that's what I mean. I mean, I think the beauty of what we're doing now, with podcasts and, just the general education that's out there that maybe wasn't, as common back in the day. So prevention is best. So if you get into wearing a night guard early, if you do all the oral hygiene things that we spoke about, then you're less likely to need to come and see somebody like me or wherever somebody else might be. But if you are in the need, and let's say you don't want to come out to London or you don't want to come out to LA, although a lot of people do come and see me.
Yeah, he's got people flying in all over.
They do travel. But if you don't, then I would say a number of things that you want to look at. First of all, don't be scared to ask questions, right? So I have people who will come into my chair and they'll literally ask me questions for 45 minutes. And I like it when they do that because this tells me that I have a serious patient who's done their homework. They know what's going on. They know what's up. And they're able to vet me in the correct way that they should. And I'm able to answer their questions. And I'm able to show them what it is that they're asking of me. And therefore, you've set the tone. And therefore, you're going to be able to, you'll know whether you're going to meet the expectation or not. I think where people go wrong is that they sit in the chair and they're like, I want veneers. And the doctor goes, okay, fine, I'll give you veneers. No. You want to go in there. You want to be, well, how long have you been doing this? Can you show me cases that you've done that are similar to mine? Can I see your laboratory? Speak to the staff members. Can I speak to previous patients? So these are all things that, I think it's important in terms of vetting your doctor and making sure that you're going to the right person that's, right for you on two levels, right? Because there's two levels in this. There's the level of expertise. So you can have a really qualified doctor who knows exactly what he's doing, is excellent at his craft. But if that doctor's not working with an excellent lab, right? So the lab is who will actually make the porcelain veneer, then his work becomes worthless because what's going to go inside of your mouth is not going to be at the quality and the standard that it needs to be. So those are two very important factors that go into play when you're talking about high-end aesthetics for the mouth, or not only high-end, but functional aesthetics, the veneers that don't pop off, they don't look artificial, you can chew normal foods and not have to worry about them cracking and breaking and things like that. So we, in my setup, the lab is in-house, which means that all my ceramists are in the same office as me. So therefore it becomes seamless because what I tell someone, I'm watching that happen and I'm under the supervision of creating what it is that I'm telling them. So I think that plays a huge role in this level of aesthetics too.
Yeah, and what you did, you educated me so much. And, I came with injuries and problems and also probably from a perspective of I never advocate for myself. I had these issues and then I just let someone do whatever they said they were going to do. I think a lot of us just, when it comes to the field of dentistry, we're just like, dentist knows best.
Yeah.
We don't know what to do. Whatever they say goes. Like, obviously you had to fix a lot of issues for me, from whatever happened to me. But I just didn't know. I just kind of went somewhere like, who can help fix my shit that I fucked up when I was a kid.
Right. And to that point, I ramble a lot in consultation. So I think probably in town, my consultations are the longest, but I always tell my patients, I'm like, knowledge is power.
Yeah.
So let me tell you everything so that you can make the best decision for yourself.
Michael, Doja Cat, The Weeknd, Dorit, PK, the Royals, celebrities. You have a lot of
I
celebrities.
like how you put me at the top of that list.
Yeah, no, but a lot of one thing about you is a lot of the celebrities that you work with prefer to be anonymous, and you're so respectful of that. I think that's incredible. Can we do? I didn't even ask you this, but can we do a giveaway for a consultation and a teeth cleaning with you?
Yeah, for sure. I think that'll be fun.
Okay, so all you guys have to do is follow. What is your Instagram?
It's my name, so it's Dr. Sam Saleh.
Follow him on Instagram. Tell us your favorite takeaway of this episode on my latest post. And one of you will win a consultation and a teeth cleaning with Michael and my dentist. I go for teeth cleanings every 3 months. I'm militant about it. Your office is the best. You've taught me how to brush my teeth, how to floss. I'm so grateful. If people want to shop your organic oil pulling rinse, get the cinnamon, trust me. Where can they find that? How can they shop your products?
So there's a link on the website.
Okay.
And then it's also linked through the Instagram page.
Okay. And then if someone wants to book veneers with you or a treatment or a teeth cleaning or anything, where can they find you? Can they DM you?
Yeah, you can DM, but it's better to go through the online form that we have. It'll take in all your information. It'll specify where you'd like to have your consultation. And then one of our team members will reach out and make all the arrangements.
One of my things that I pride myself on, as we know after this conversation, and yourself, is aesthetic. So if you guys are looking for anything aesthetic when it comes to dentistry, this is your guy.
And functional though.
And functional. And I'm a psycho about vetting. I mean, I'm a practitioner of just like looking who is the best of the best. And I am putting my stamp on Dr. Sam. I have to look at Michael's teeth every day. So you actually you didn't do that for Michael. You did it for my eyes.
Listen, I had problems.
Thank you to your entire office, to Monica, Dr. Lee, everyone at the office. You've been so amazing. You guys go see Dr. Sam and just give your practice a shout out and the URL one more time.
And go floss your teeth.
Yeah, go floss your teeth. What's the practice if they want to Google you?
Dr. Sam Saleh.
Easy. All right. Thank you,
We'll
Dr. Sam.
Thank you.
Thank you, buddy. Thank you for coming in.
Thank you.
10 out of 10.